and surrounded by fear and stigma despite being curable. We're joined by Dr. Klementine Kabono now, Acting Senior Medical Officer at the Nkurenkuru District, as we prepare to commemorate World Leprosy Day under the theme, Leprosy is Curable, the real challenge is stigma. The commemoration is set to take place on the 30th of January in the Kavango West Region. Dr. Kabono, good evening and welcome to the Daily Roundup.
Good evening. Thank you very much.
Well, Dr. Kabono, I hope we can hear each other clearly through this conversation. But to start with, what exactly, is leprosy and how common is it, today still, particularly in Namibia?
So leprosy is a chronic medical condition which is usually found in the mouth and nose of patients or people. And then what happens is this infection, once you cough onto someone or you sneeze onto someone, you can transmit it through chronic and many years of contact. And then it goes onto the skin, and then the nerves is what it affects. Usually on the skin, it causes pimples or papules. And then after some time, it goes into the nerves, usually the peripheral nerve, which ends up causing cartilage being absorbed by the body, which now ends up causing the amputation or self-amputation of the toes, fingers, sometimes even it causes sudden nose, and then even amputation of the ears. That is basically what leprosy is. And then the numbers, we are still facing a few of cases in the country at large, and then the region also. Currently, in the region, we have about 5 confirmed cases. But to note is leprosy, the moment we note even just one case, it becomes terrible for us.
Well, talk to us a little bit about what the early signs and symptoms of leprosy are that people should be aware of.
So the early signs, just like I explained earlier, what leprosy really is, it usually causes a pupil repeating. That is usually lighter than your own skin or hyperpigmented. And then that pimple does not grow. It's not painful. Even when you touch around that pimple or papule, you won't feel any, there's no sensation in that area. And then with time, it keeps on going for many years. So many of the patients end up missing it because it's a painless, and to some of them it comes non-disturbing. That's why most of the time it's missed. And then some of the signs also is you can have a wound that is not healing for a chronic time, for a long time. And then that wound, even though we keep treating it at the hospital, it's not improving. And when you touch around that wound, it's usually also painless. And then the other thing is tingling and numbness in some areas of the body, usually peripheral areas, which is usually the toes and the fingers. And most of the patients end up with being cut or being pricked by something, but they don't even feel. So basically, it's just about loss of sensation also in the peripheral area. Those are some of the most earliest signs. But after a chronic time, that's when there will be now the obvious signs that we usually all see, which is the self-amputation of the toes and the fingers.
Well, this year's theme, highlights that leprosy is curable and that, the real challenge around this is the stigma. How does this commemoration help address the stigma in our communities?
The commemoration day, usually what happens is before we reach the day itself, there's awareness that we do. From the hospital side, we include all the communities at large to try and teach what really is leprosy, what are the signs, what are the symptoms, is there treatment. And with this, at least we are able to spread out the word that definitely leprosy is curable. And then in that same manner, it's when you give the signs, just like I explained, somebody might be noticing that, okay, these are some of the signs that I've been having. Like, for example, last week I gave a radio talk on leprosy. I've already started receiving patients that were having these symptoms. We are able to diagnose them early. We are able to treat them early. So the commemoration day also allows us to be able to reach out to the people that already have the disease so that they can feel that the government at large, the Ministry of Health, healthcare workers, we do care about them and we want to be able to cure them and be able to go back to their houses and do contact tracing to prevent further spread of the disease. So that's why it's very much to keep on commemorating this day so that the healthcare education reaches to the patients or everyone at large. Sometimes it might be your neighbor, but you heard it from somewhere. You are able to bring them next to the hospital and they are able to get treatment and it can be cured. And then we are able to prevent patients reaching the late stage of the self-amputation of the tooth, which is what we are usually used to see.
What role would you say, events like commemorating World Leprosy Day plays when it comes to encouraging people in seeking early diagnosis and treatment?
So the role that we play, just like I explained earlier, is to try and mitigate full understanding and health education about what the disease really is and what can be done. Is there something that can be done? Are there medications that are available? This is how patients actually speak to us because from the history of the disease, looking at the religious background and also in our community, what used to happen previously is if you are diagnosed with leprosy, due to lack of understanding that previous event, all patients have to be transported to a certain area in Kavango, it's Mashari. So it was kind of like if you are diagnosed, you are an outcast. Even when you read the Bible, somebody who has leprosy is noted as maybe somebody who is scared. But right now, this role that we're doing the commemoration is we are trying to sensitize the community at large and give health education so that everyone understands the signs and symptoms, which are the early signs. When you are able to prevent early, we are able to treat you on time. You won't even end up having the amputation that we are talking about. And then also for the rest of the community to also understand that even though you have leprosy, it does not mean if I touch you with a finger that is amputated, I pass it on to you. The transmission also needs to be fully understood by the community, and it also helps them now to come early to the hospital and be able to get treatment.
Well, Dr. Kabono, just lastly, what message is it that you'd like, the public to take away from World Leprosy Day commemoration?
My key message is leprosy is curable for as long as a patient presents to the hospital on time. We are able to prevent them from ending up with the disability that most of our patients end up with. And then I want also the community or the patients that are already affected by leprosy and they've already gotten these self-amputations that we are talking about. We want them to know that we do care about them. That is why we have picked this specific day to be celebrated throughout the whole world, the country at large, to know that we do really care about them and we have not forgotten about them and we will continue to treat them and make sure we keep them in the community. That is my most key message on the commemoration day.
Dr. Klementine Kabono, thank you so much for your time. Thank you for joining us here on the Daily Roundup.
Thank you.
That was Dr. Klementine Kabono, Acting Senior Medical Officer at Nkurenkuru District, speaking to us about World Leprosy Day and understanding, of course, the disease and the commemoration that they'll be exploring. I'll be back after this brief break. We speak Miss Namibia and Miss Teen Namibia. Stay with us.